Hello and welcome. This is Kayhan Parsi, your instructor for Religion and Bioethics. I'm really quite delighted to be able to take this opportunity to broaden our understanding of different religious traditions in this course by interviewing various faculty here in the theology department at Loyola University Chicago. And today my interview is with Professor Anna Marie Wiegand. Professor Wiegand has a PhD from the Union Theological Seminary at New York, and her specialty is in racial, ethnic, and socioeconomic disparities in healthcare. So what I'd like to do with this interview is ask Professor Wiegand a few basic questions about Christianity, about different traditions within Christianity, to give us a better understanding of this obviously very important religious tradition in the world. So welcome, Professor Wiegand.
Thank you. I'm delighted to be here.
Good, good, and I'm quite happy to be able to do this with you. Really what I wanted to do is just ask you a set of questions during this interview to give us really a fuller understanding of the Christian tradition. I know it's a tall order for a half hour or 40 minutes, but first I just wanted to ask you, since you're a scholar in theology, why is the study of religion important? Not just for a scholar, but for anyone, really.
Mm-hmm. And I should emphasize that, just so that the folks listening understand, I am an ethicist who's both a social ethicist and theological ethicist, but I'm not a church historian and I'm not a systematic theologian. So I'll give you my take on it, but within the confines that really ethics is where my heart is and where my emphasis is. So I look at religion always through that lens. And so in answer to your question, why is the study of religion important? I think because knowing where different faith traditions come from and what they articulate as the meaning of life. I mean, what matters ultimately? Why are we on this planet? And having a conception that comes out of that, not only from philosophy or from a biological understanding or a scientific one, gives a sense to another moral vision or worldview for making sense of human obligations, responsibilities, nurturing of creation of our own bodies, of one another. And while there will be a wild divergence of responses to that question, what matters, what does it mean to be human, why are we here, I do think that bringing in another lens, another set of metaphors from whether it be Christianity or Buddhism or Hinduism, adds something unique to the dialogue. It means that there is another dimension that goes beyond simply human beings being the end or perfection of creation, but that we are part of something that is still greater than us, and articulating that and what that greater thing is and how we are related to it, and then what that divine human relationship has in terms of implications for then human relationships or human stewardship of creation is an important thing to articulate. It's a way of, is healthcare, for example, something that is a commodity, a good, a service that can be bought and purchased, or does it have something more fundamentally to do with human caring and nurturance and obligation to one another because we are sacred creations of a divine, loving, just being? I don't think Christianity or any religion should have the ability to trump any discussion, but I do think the moral lens, the worldview that it brings of each particular tradition can add something rich to these discussions. And you need, in order to do that, you need to know religion and its history and its evolution to be able to have an intelligent appreciation of that.